Finding a job. Graduation is a lot closer than you think. Health services is a fast-growing employment area, especially due to the baby boomers. Employment of LPNs again is projected to grow 21% between 2008 and 2018, especially in the areas of long-term care, but also in skilled or intermediate facilities, rehabilitation, residential care or developmental disability areas, medical surgical units, assisted living, home health, hospice care, and some critical care and emergency departments. But those who have a military history are more likely in that last area. So what type of interpersonal style do you have? An analytical type is highly detail-oriented. They can make difficult decisions without having all of the facts. They're very perceptive, but they may tend to be pessimistic. A driver type tends to be very blunt. They're objective-focused. They're hard workers and make quick decisions. They're an independent, can-do person. An amiable type likes to be liked. They're easygoing and they're not big risk takers. They tend to blend in. They're very sensitive and have difficulty making firm decisions. They often can be quiet and soft-spoken. An expressive type is a natural salesperson or storyteller. They're very gregarious and they're good motivators. They tend to exaggerate and leave out facts and details. They are relationship oriented. To make a good impression on people, you need to be sure you listen to what they have to say. If you disagree with someone that you want to maintain a rapport with, use artful vagueness. In other words, responding to another's comments without implying that either of you is right or wrong. Networking for references can be done through your instructors, through the people that you work with or that you have clinicals with, such as unit managers, supervisors, team leaders, registered nurses, and other LPNs, in addition to school placement personnel. As you're networking for a job, you need to let people know that you are looking for a job. Ask for any job leads and names of contacts. Networking should be a never-ending process. So some different sources would be family and friends that have nursing contacts, former healthcare employers, newspapers, nursing journals, a school alumni office, and the internet. The informational interview allows you to find out how the facility works, and it will assist you in determining whether or not you want to work there. So the assignment that you have been given is going to kind of be a preview of what an actual interview would be, but also would be a preview of the facility. Again, is this a place that you want to work or not? I had a student tell me after completing this assignment, thank you, because an area that she was really interested in applying for, when she went in for the informational interview, she changed her mind very quickly and decided this was not an area that she really wanted to be employed at. So how do you search for employment openings? Well, you need to enhance employment opportunities by displaying a positive attitude with clients, seeking the supervisor's input on how to begin your career, work on building relationships with peers and key people where you work, and getting involved in facility and professional organizations. There is a hidden job market, and sometimes basically that means that the jobs are not being publicly advertised, or not everyone knows that there is a position available. So you have to have the right networking to be able to find some of these jobs. And you can do this with assistance from family and friends, employment recommendations at clinical sites, submitting direct applications to employers, searching company websites using terms such as careers, employment, jobs, etc., state job service or workforce centers, internet job sites, private employment or recruiter companies, searching state or federal government websites, school placement offices, attending job fairs, etc., volunteer activities or professional associations, and contacting the state nurses union and asking about employers who are hiring. The Kansas State Board of Nursing newsletter also has several job openings, and when you receive your license, you will, on a quarterly basis, receive the Kansas State Board of Nursing newsletter. So when you are applying for a job and it's time to sit down and answer some of those application questions, there's a few things that you need to be aware of. You need to document your reasons for leaving if you were not at a job very long. Otherwise, play it on a case-by-case basis. If there's questions that you wish to defer until the face-to-face interview, write "not applicable" or "we'll discuss," or leave the space blank. You should not specify a dollar amount under the wage expected. Be aware that you don't have to answer questions about your age, religion, marital status, children, physical data unless there are specific requirements for the job, workers' compensation injuries, or a criminal record unless it relates to theft, assault, or the use of drugs. When you prepare for the interview, you need to prepare some questions to ask and think about what is it that you really want to know about this particular job, this facility, this opportunity, etc. Practice responses to possible questions. For example, when an interviewer says, "Tell me a little bit about yourself," make sure that you focus on professional experience and educational background. There are some sample questions in your book that, let me start over. So as you are getting ready for your interview, you need to prepare by practicing. And in your book, there are some sample questions, and I'll give you a few now that you may be interested in knowing for the facility. And understand that some of those questions may be answered during the interview process without you having to ask them directly. Some of those questions might be, what type of patients will I work with? Or will I be floated to other units? What type of charting system is used? How is scheduling handled? What is the nurse-to-patient ratio? What type of uniform is worn? Will overtime be available if I want it? Again, those are just some samples. So to make a lasting impression, there's many recommendations throughout the chapter that regard interview tips and your appearance. Your appearance is very important. Personal hygiene, make sure that you bathe before you go, and make sure that your hair and nails are clean and neat. No black nail polish, for example. Avoid excessive perfume or aftershave. Avoid bad breath. Make sure that you dress professionally and conservatively. Keep your makeup to a minimum and be very conservative with it. Wear simple jewelry only. Your posture should be walking tall, sitting erect in the center of your chair, and keeping your hands inactive. You should not interrupt the interviewer or try and rush the interview. Eye contact is essential. Don't make negative statements. Avoid the impulse to interrupt the interviewer. A firm handshake is essential. Don't shake hands with that limp wrist. That, to me, that is just sends revulsion chills up and down my spine. Be very courteous by arriving 5 minutes early. Make sure that your cell phone is shut off. When the employer enters the room, stand, smile, and extend your hand for a firm handshake. Address the employer by their surname, Mr., Mrs., Ms. Thank him or her for the opportunity to interview. Don't chew gum. Don't smoke prior to going to the interview because the smoking can cause you or your clothing to retain the odor, and that can be very offensive. Politely refuse an offer of coffee, tea, or cigarettes. Generally, you should wait a couple of months before disclosing a pregnancy. When you are ready to talk about your pregnancy, be prepared to discuss how long you plan to work, how long you intend to be gone, possibly how your work will be covered while you're away. Expectant mothers will have both good and bad days during pregnancy, and friends can be a good help. A job offer might be conditional. In other words, you may have to pass a physical or a drug screen or a background check before a job offer might be solidified. With drug screening, be aware that although drug screening accuracy is improving, it still is not 100% accurate. There are false positive drug results if medical conditions such as kidney infection or disease, liver disease, or diabetes exist. Think about common foods or medications that might cause a false positive drug result. After the interview, realize that it's no longer only up to the employer to notify job applicants. It is okay for you to make a phone call to make sure that you are keeping track of what's going on with the position opening. Make sure that you write a thank you letter to the interviewer the same day that you're interviewed. And make it a practice to not make any follow-up contacts on a Monday. Mondays are usually really a full day because of staff meetings, solving weekend concerns, staff discipline, paperwork catch-up, and other duties. The best time to make a follow-up call would be after 9 o'clock in the morning. In my book, on page 314, there is an example of how to have a conversation with a secretary. It can be acceptable to leave a job within 3 months in certain circumstances, but you shouldn't list those jobs on your resume. Be very positive when you leave the job. Do not cut your ties by being negative and throwing out accusations or being very rude. Preferably obtain a new position before you resign. Giving 2 weeks notice is called resignation courtesy. Make certain that you present a resignation letter in business format on plain paper and keep your personal frustrations or complaints out of the letter.